All right. Thank you. Good evening, good afternoon, good morning, everyone from everywhere. Because of our time differences, I have to respect all salutations. Thank you for making time for this webinar. And thank you for always sacrificing to learn something new. Today's webinar is titled Career Opportunities for Pharmacists in Global Health and Supply Chain. It is co-hosted by the Empower School and the Pharmaceutical Society of Zimbabwe. As you can see from our first slide, these are some of the co-partners, the Ministry of Health and Childcare here in Zimbabwe, Udugu Institute, Harare Institute of Public Health, and the International Pharmaceutical Federation. The next slide is basically just showing you who our panelists are. And today we are going to have a talk in the next hour from the four panelists and the moderators that you have seen. I will not introduce them at this point because my co-moderator will do the same. So this webinar, as I've already mentioned, is being done in collaboration with the Empower School of Health. And we have, as the Pharmaceutical Society of Zimbabwe, accredited it, and the members of the Pharmaceutical Society and pharmacists at large are going to be able to get 5 CE points for attending the full webinar, keyword full webinar. So I hope we'll be paying attention and we'll be able to get that. So just a few housekeeping announcements. As for common etiquettes, kindly make sure that when you join or whilst you join, you turn off your mics. Also kindly turn off your videos because they do affect the bandwidth and the performance of the call. You can always put your questions in the chat box. And at some point, if you feel the urge to speak, you may wish to raise your hand. If it allows, one of our hosts will allow you the speaking rights, and then you can go ahead. Available at the YouTube channels of the Empower School of Health. We're also going to have this being recorded on Facebook, so that should be available on the Facebook pages being shown here. Your feedback is really important. It helps us improve all our webinars. And if you have any feedback, feel free to, I think, put it in the chat box, but there will also be an opportunity for you to give feedback. So not wasting much time, straight to the agenda of this webinar. We thought it necessary to give the agenda in the form of questions. So we hope we're going to address the following questions during this webinar. Why consider health procurement and supply chain as a career? Well, from a health professional perspective, why is there limited human resources capacity? And number 3 here says, how do you get started in procurement and supply chain management field? And number 4 says, how do you get right accredited courses, credible? In other words, how do you get courses from credible institutions when you want to pursue the field of procurement and supply chain management? After these have been answered, we are going to have an open question and answer section where we can have a discussion and see if we can get more feedback from different panelists. We'll also have like a summary and also closing remarks from the rest of the panel. And as I said in the beginning, we will have our CE certificates automated at the end. Please do not leave until the end of the webinar if you need to then get the CE certificate. Our objective on the next slide is that by the end of this webinar, participants will have a good understanding of global careers for pharmacists, including access to medicine. So allow me to introduce my co-moderator who will take over as I decide to mute my mic. My co-moderator today is Miss Florence Chingwena, who also graduated from the Empower School of Health with her postgraduate diploma in supply chain management. She is the head of pharmaceutical services in the city of Harare, City Health Department. She is a public health official, a health procurement specialist, a pharmaceutical supply chain management specialist, an integrated disease surveillance and response pharmacist with over 20 years experience at senior management position in both public and private health sector. She has worked with the donor community in several health programs and pharmaceutical chain management activities for over 10 years. As you can see, she's well suited to be a co-moderator for this session. And I'd like to welcome Miss Florence Chungwena and give her the floor to go ahead with moderation. Thank you.
Thank you, Prosper, for that warm introduction. Thank you for taking us through the introductory slides. Allow me to introduce Prosper. Prosper is our Secretary of the Pharmaceutical Society of Zimbabwe. He's a pharmacist with working and leadership experience in both sectors of the pharmaceutical industry. He served as an African Regional Chair and Vice President of the International Pharmaceutical Students Federation, the largest faculty-based organization in the world, where he championed the expansion of the organization in Africa and spearheaded the hosting of its first ever World Congress in Zimbabwe. Apart from this, his pharmacy management roles, Prosper is a leadership soft skills trainer and the continuous education coordinator. And allow me to introduce one of our panelists, Prof. Paul. He is the founder and director of Empower School of Health, which was founded in India and is currently present in more than 10 countries. He is the deputy chair of People That Deliver, which is hosted by UNICEF. And he's the founder of the Center of Digital Learning in Global Health. He's the former head of the procurement and supply chain at the Global Fund, Geneva, and has advised WHO, World Bank, UNICEF, Gates Foundation, and several other organizations. He's a man of many achievements. Allow me to introduce Prof. Andy. He's the professor of the Public Health Institute and director of training at the Empower School of Health. Andy is one of the co-authors of the Yellow Book, which is often referred to as the Bible of managing drug supplies by the Management Science of Health and the WHO. He has over 20 years of experience of working with USAID, DFID, the UK government, and the Management of Science of Health. He's a man with many achievements across the world. Allow me to introduce one of our panelists as well, our very own president, Potiphar Mwendera, the president of the Pharmaceutical Society. He's basically been working in the retail pharmacy sector since 2002. To date, he's been working with the retail pharmacy section. He has been a member of the Pharmaceutical Society of Zimbabwe since 2003, and he has served on the Mashonaland and Manicaland branch committee for the majority of the years, which he became a branch representative on the Pharmaceutical Council. He has held various positions within the Retail Pharmacy Association since 2012, when he joined the executive committee. He has interests in community pharmacy, especially when working at the interface between public health and the private enterprise, a man of many achievements. Our last panelist is our Acting Director of Pharmacy Services in the Ministry of Health and Childcare, Mr. Davison Nyashavuragu. He's a man of many achievements. To list a few, he has been working with the Parinyatwa group of hospitals as the chief pharmacist, and he has spearheaded the pharmacy section and maintained good pharmacy services through the harsh economic environment, despite the high turnover of pharmacists within the public sector. He has trained numerous pre-registration students and community service pharmacists, and he has contributed immensely in setting up standard operating procedures for procurement in the Parinyata group of hospitals. He has trained many cadres within the Ministry of Health on stock management, and he has been awarded by the Pharmaceutical Council of Zimbabwe a prize for outstanding contributions within the public sector. Allow me to hand over to Prof. Andy and Prof. Paul to continue.
Could I ask for this particular slide? Many of you already know about the Pharmaceutical Society, but if I could ask the President Portifo to introduce the slide.
Okay, thank you, Prof. Welcome to everyone, and good evening to pharmacists joining us in this webinar. So basically, this is like preaching to the converted. I need to talk about the Pharmaceutical Society of Zimbabwe, and we have basically been promoting the work and the obligation of the profession. And amongst this, we are mainly for encouraging the goodwill of pharmacists and other allied professions. We do help in the setting of standards for the practice, and we do have an ethical code that guides us. Our main issue has been to broaden and increase the knowledge in the art and the science of pharmacy, both in Zimbabwe and for those who are outside Zimbabwe. We do monitor and advise on the pharmacy training and encourage students, both graduates and also postgraduate pharmacists, to actually look at the ways and the mysteries of pharmacy. The society works together with its local and other regulatory bodies to ensure that these objects are upheld. Hence, you find us in this collaboration with Empower Health. And this is mainly to ensure that the good health of the nation is achieved through quality service provision. We do have continued collaborations with the Pharmacists Council of Zimbabwe, the PSZ, the schools of pharmacy. And I would like to say that over the years, members have received support and guidance in their respective areas of practice from the society through the society's goals and its ethics committee. The society is also guided in international practice through its membership and affiliation to other international and regional bodies. We are a member of the Commonwealth Pharmaceutical Association. We're also a member of the FIP, which is the International Federation of Pharmacists. We're also a member of AFRO, which is the African Pharmaceutical Forum. And we do have a SADC pharmaceutical committee, which is actually in its initial stages, but it's work in collaboration. Okay, I would give this back to Prof. Andy.
Could I ask Mr. Davison for the introduction here, please?
Thank you, Prof. Thank you, everyone. for coming, and thank you for the initiative for this important meeting. And I would like to thank everyone that has managed to attend, and I deem it a privilege to be part of this meeting. As Minister of Healthcare, ministry is the responsibility of the Minister of Healthcare is to promote the health and quality of life of the people of Zimbabwe, and it's committed to ensuring that there is equity. The ministry in the early, soon after independence, adopted the primary health care approach, and where priority health issues are identified, and then resources are channeled towards actually meeting the priority health needs of the country. And there are several health promotion programs to actually ensure that as many as people as possible, there's health education, the emphasis being on actually health promotion and prevention, just to ensure that people are healthy, but also then for those that they need care, to have quality, affordable, accessible services, as well as at the different levels of care, right from the primary, secondary, tertiary, right up to the highest level. So there are various quality programs in the ministry to ensure that quality care is provided. So to try and achieve this, the ministry aims to ensure value for money through efficient and effective services. So the issue of procurement and supply chain is key. You find that about 40% of the total Ministry of Health budget goes towards procurement of medicines and medical consumables. So it's key that the limited resources that are there are actually efficiently used. It involves a lot of planning, a lot of strategizing, community engagement, and resource mobilization. So pharmacy directorate is at the heart of all these activities, and responsible for the policy formulation as far as medicines and medical consumables is concerned. We have many partners that we work with, different stakeholders, the regulator, Medicines Control Authority of Zimbabwe, the National Pharmaceutical Company, which is the national procurement agency, even the different professional associations, Pharmaceutical Manufacturers Association, Retail Pharmacists Association, Pharmaceutical Society, the Researchers Association, the schools of pharmacy, the training schools. The one thing that's of note, especially at this particular point, is the thrust in the government in trying to capacitate the local industry to actually increase, restore production, and actually even increase production. So that's what I would say basically in summary from the ministry point of view. It's the leading in the vision and the direction for the health services of the country. Thank you.
Thank you very much. That's very comprehensive. Andy, could I ask you to speak on the International Pharmaceutical Federation?
Okay, so FIP, we use the French language acronym, Fédération Internationale Pharmaceutique, FIP, more than 100 years old, represents 151 countries. This really is the global organization for all things pharmaceutical. In particular, it sets the global standards, along with World Health Organization, for the practice of pharmacy, and that includes supply chain of medicines and health products. It leads pharmacy at the global level. And I'm sure you all know already that this week is World Pharmacy Week. Lots of events, regrettably this year because of COVID, they're all virtual events. They won't have the big conference meetings that are normally held. But throughout this week, lots of events happening all around developing new standards from industry all the way through retail pharmacy practice, all the way through the public sector, of everything that pharmacists do. If you're not already a member, you should seriously think about joining FIP. Okay, on to the next one then, please.
Thank you. And it's World Pharmacist Day on the 25th of September as well.
Yeah, that's
so
on
you may
Friday.
wish to celebrate. That's
Yep.
right. Could I ask do we have somebody from HIPH? And if not, I can ask Florence to take this slide since you've been in contact with them.
I'm not sure if there's anyone who is logged in yet.
Could I, and they might be on mute. So if there is somebody, if you could just send a message on the chat saying that you are present. Otherwise, it's no issue. You can always speak a bit later as well. Florence, why don't you briefly just introduce HIPH?
HIPH is the Harare Institute of Public Health. Its main mission is to develop a competent workforce of healthcare from individuals with passion through utilization of science, technology, maths, in and heritage based on solutions for the public health in Africa. So they're basically focusing on public health and developing the public health in Zimbabwe. It's a center of excellence in public health training. They're currently training pharmacy assistants, nurse assistants, and they're also involved in a lot of research, which is vital to support the public health institutions. FIPH conducts teachings, trainings, and research in relevant fields with special focus on training graduates at certificate, diploma, degree, and continuous professional development for many different programs. And currently, HIPH is working with Empower School of Health so that we can have partnership in making sure that we have trainings and continuous professional development in supply chain management. The primary aim of the Harare Institute of Public Health is to improve access to health. So they want to make sure that health is accessible, affordable, and available to the majority of the population of Zimbabwe. They promise to listen to the market and science in their quest to advance public health systems in Africa and beyond.
Perfect. Thank you.
Thank you.
I'll very briefly mention about Udugu. Unless we have somebody from there, you could quickly send a message. Do we have Mungai or anyone? And if not, Udugu is headed by the former head of the World Bank. He headed the World Bank in Zimbabwe, and excuse me. He founded this in 2015. Three main areas: policy, innovation, and education. And we are collaborating with them on innovative ways of building large-scale capacity in Zimbabwe. And this gentleman, Mr. Mungai, brings tremendous experience, global experience, heading one of the world's largest UN agencies in Zimbabwe. So just to make sure that you are all awake, we have 122 participants approximately. What we'd like to do is make sure that there's engagement and it's not just us speaking. We want to try to understand the participants. So if you could take a few minutes just to answer a simple poll, which has 5 questions. You'll see it on the screen. It will take you maybe 60 seconds or 1 to 2 minutes, basically. And then we'll share the results with you right now. Okay? So please go ahead. been about a minute and about 40% have already replied. This is good. And for a change, I see there are more women than men, which is good to see. This is good. We're closing in on 70% responses. We'll give another 15 seconds. We'd like to get everybody's vote in. All right, so that's good. About 73/4 of the people have voted. We'll pause the voting and share the results. So about half and half, men and women, which is a good mix. We've been in webinars which has ranged from, this is probably the first one which is tilted more towards women than men. And that's a good thing because we're trying to promote gender inclusiveness and gender equality. So this is great. Age, the mode is 30 to 40. That's good. If we look at what geographic region you're from, 74% are from Zimbabwe, Southern Africa, 9%, rest of Africa, 9%, any other region, 7%, which makes sense. We were targeting Zimbabwe with this webinar. What is your academic background? Pharmacy technician, just 2%, majority of pharmacy with a bachelor, pharmacists with a bachelor's degree, and pharmacists with an advanced degree in any area. That pretty much comprises, 93%. Perfect, so we will tailor our conversation to pharmacists. And years of experience, which makes sense, less than 5, 30%, and 6 to 10, about 30% as well, and some with greater experience. Perfect. Can you please stop sharing so I can move on? Oh, have we shared the results with everyone? Could they see it?
Yes, it's been up on the screen, all clear.
Yeah, did everybody see the results? Okay, because it says here now share results, but I'm not sure. So here's what it looks like, almost 50-50. Age, 30 to 40 was highest. Majority Zimbabwe. Pharmacists with bachelor's and advanced degrees, pretty much more than 90%. And 5 to 10 years experience, majority of the lot. Okay, all right. Can you please close the poll? Let me see if I can do it as well. Here we go. So about Empower, our whole focus is on building capacity. I mean, as the name of our organization states, it's about empowering, enabling, engaging, evaluating, and empowering the target groups that we work with. And His Excellency, the former president of Ghana, he's a mentor to our organization and our group, incredible human being. And when we have done courses on leadership, pre-COVID, obviously, we have actually taken people from around the world to Ghana who have then interacted with His Excellency. It's been an incredible experience. Our reach, it says 100,000 learners reached. It's now actually 200,000. We have an updated slide, more than 100 countries, lots of organizations, and many hours of training delivered to multiple countries, multiple organizations across the world. So these are the organizations that have either funded us or partnered with us, and there's many more that we have not included. And of course, Ministry of Health Zimbabwe is one of them. And we believe in South-South collaboration and also working at the global level And I'll give our personal backgrounds briefly as well, so that you see what it takes, no matter how humble your background. And trust me, I come from a very humble background, growing up in India and in Nigeria, and drifted my way to a relatively high level in the UN agency, Global Fund, before launching the Empower School of Health. So rather than drifting, if we can help you plan your careers, you can, and many of you are still in your 30s and 40s, you can accelerate that growth as well. These are letters from the Pharmacy Council of Zimbabwe and the Ministry of Health of Zimbabwe, indicating, one, that we are an accredited organization with them, and the ministry stating that the individuals who graduated from our program have made a significant difference to the supply chain program at the ministry, and that's from the Secretary of Health. So testament to our support that we're providing to pharmacists. I'll hand these, just before I hand this over, and Prof. Andy will take over. But just as an introduction, I'd like to mention, when I grew up, and most of the time it was stated that as a pharmacist, you pretty much had 3 options: retail pharmacy, hospital pharmacy, or industrial pharmacy. And within industrial, it was either manufacturing, QC, or sales and marketing. No one ever offered the option of global health and pharmacy. And it has been, I stumbled onto this area about 25 years ago, and it has been one of the most fulfilling experiences for me. And I'd like to take this opportunity to share how you can enter this career if it is of interest, and also for some of our colleagues and panelists to share their experiences. And FIP, the global organization, this year has declared this annual year as Transforming Global Health. And this is not normally what pharmacists are known to do, but they are definitely able to do, and this is where the careers are headed and options are headed as well. So with this, Prof. Andy, over to you.
Okay, greetings to all. So why consider health procurement and supply chain? Because we need that to make medicine work. Modern medicine is about having access to modern medicines. And yet, in the world, 2 billion people, nearly a third of the world, doesn't have access to medicine. We look at our world map, these are rather dated figures, but they still apply. We can see all the red areas across Africa. We're not getting the medicines to the people. Why are we studying academic pharmacy when we can't get medicines to people? Many of you joined pharmacy because you wanted a role in global health. You wanted to be involved in healthcare delivery. And yet, without procurement and supply chain, we don't get delivery. Okay, next slide, please. Many of you will already be aware of the Sustainable Development Goals, and especially the SDGs for health. As we look at all the SDGs for health, every one requires the delivery of an uninterrupted supply of quality assured health products. 3.1, reduce measles, mumps, and rubella. We can only do that if we can deliver the measles vaccines where it's needed. The most rural areas, within the most dense urban areas, we have to be able to get to all of them. 3.2, end preventable deaths under 5 years of age. To do that, we need oral rehydration salts. Very simple, very cheap medicine. But if we can't get it to the patients, it doesn't work. All across these SDGs, we have to be able to get the medicine to the patient. And that's really what supply chain is all about. It's an extension of pharmaceutical activity. Next slide, please. But supply chain failures are recognized. We have this classic statement from the Director General of the World Health Assembly: all the donated drugs in the world won't do any good without an infrastructure for their delivery. Over the last 15 years, many of the international donors have stepped up and provided millions and millions of dollars worth of medicine. But the impact is not as large as we would have expected because we haven't got the medicine through to the patient. This last mile delivery, we're not getting it there. Often we have poor infrastructure of roads and transport, but we have techniques to overcome that. But we're not applying them in the ways that are needed because we don't have the skill sets around supply chain. Next slide, please. Okay, poll 2. We bring the poll up on the screen too. Just to make sure you're all still awake and that you are paying attention to what we're saying, if you could now please look at the poll questions and respond to the polls. Which area of pharmacy are you working in? Please choose just one. Even if you're working in multiple ones, please just choose one. Which type of organization are you working for? Ministry, governmental, health delivery, academic? Have you previously worked in health supply chain? Okay, we have, oh, very fast now. You're getting used to doing the polling. We're nearly at 50% and it's not even 1 minute yet. Well done. Okay, at 1 minute, we have 70% voted already. We'll take just another few seconds to see how we're doing there. Okay, we can stop the poll there and share the results, please. Okay, so a lot of people, 47% working in retail pharmacy, that's good. And we'll be sure to say a little bit more about retail pharmacy as well. Most people are working in the private sector with the ministry a close second there at 28%. And pretty evenly split. About half have worked in the supply chain before and half haven't. Okay, so we'll try and tailor our responses around that as we move forward. So just once again, running through the results, most people are in retail pharmacy, working in the private sector, and about half have previously worked in supply chain. Okay, we can stop sharing the results now, please. And okay, back to supply chain. One of the major challenges in global health supply chain is the lack of human resource capacity. We don't have enough people. World Health estimates that the vacancy rate is 30 to 70%. And the workers we have don't have the skill sets that we need to undertake effective supply chain activities. So it's a double problem. Not enough people, not enough skills. And that's been known for some years now. We're not attracting enough pharmacists into procurement and supply chain. Next slide, please. But why is there limited human resource capacity in the supply chain? Well, it's because it requires two sets of skills. It requires pharmacy skills and management skills. And regrettably, few schools of pharmacy teach very much procurement and supply chain management. Some schools teach small amounts, but not really adequate for a career in procurement and supply chain management. Virtually no management schools teach pharmacy. What we need is pharmacists, but we need pharmacists who are knowledgeable and skilled in procurement and supply chain management. It needs the two areas to come together. so that we have both pharmacy and supply chain management. Next slide, please. Further, this is a very expanding field. Over the last 15 years, major donors have invested hugely in developing new products, especially for communicable diseases. Those products are now emerging from the development pipeline and becoming available. There's over 200 new vaccines are being produced. Many of you will know about the malaria vaccine trials already. A huge amount of new diagnostic tests, which are point of care tests, just like the rapid HIV test and the rapid malaria tests. Far more of those now coming from the development pipeline. Over 80 new medicines, many of them specifically developed for neglected tropical diseases. For years, we've not had medicines for these neglected diseases. They're now coming from the pipeline. In total, over the next 5 years, more than 436 new products coming out. That means pharmacists need the technical skills of those new products, but supply chain also needs the skills to be able to manage this increase in all these new products. How are we going to manage the capacity and the different requirements of all these new products unless we have skilled staff? Next slide, please. There are many organizations involved in the global health supply chain. People often tend to just focus on one or two and think, well, of course, there's the Ministry of Health. They do it, and indeed they do. But there are many UN agencies, donor organizations, faith-based bodies, non-governmental organizations, all involved in undertaking supply chain activities as well. We shouldn't get fixated on just one organization. It's a very wide range of organizations, all looking for supply chain staff. Next slide, please. So who are these key stakeholders? Well, of course, there is the Ministry of Health and Department of Health. There's all the donor organizations. And again, people tend to focus just on the very big organizations like USAID and Global Fund. But there are other organizations, Luxembourg Aid, Swiss Aid, that people don't recognize so well. We need to think about opportunities across the board of the bilateral and multilateral donors. Lots of UN agencies. Again, people tend to think about UNAIDS as the big agency and neglect some of the smaller agencies, but UNDP is involved as well. There are implementing organizations like MSH and JSI, often undertaking specific projects looking for people. There's all the faith-based organizations and the not-for-profit sector. Advocacy, university and education, increasingly now we're seeing health insurance groups seeking to manage the health supply chain because it reduces insurance costs if they manage the supply chain effectively. Just as the Ministry of Health has realized for years, in order to deliver value for money, you have to control procurement and supply chain very well. The health insurance groups are now coming to the same realization and investing in global health procurement and supply chain activities. Increasingly, we're seeing the private sector on corporate social responsibility, investing in supply chain organizations and activities. And finally, community groups focused on patients and beneficiaries. So a very wide range of stakeholders. Don't look at just one or two, look across the whole field. Next slide, please. Time for me to hand back to Prof. Paul.
Thank you very much. So I started my career as a pharmacist and then went on for other opportunities. Actually, I did retail pharmacy, like many of you. After I was done with that, worked in clinical pharmacy. This was all in the United States. And then industrial pharmacy and manufacturing, first in the United States and then in Nigeria, where I spent 2 years starting a generics factory. And this is going back at the time 1990 to 92. Went back to management school, business school, studied my MBA, studied public health, and then worked in the public health field for the longest time. But what is fascinating and interesting, which no one told me, is that we had another option to work in. And if you look at the potential jobs that are linked with pharmacy, and this is just some of them, we have another 50 or 100 more, working in different parts of the world, and working in different aspects of pharmacy, whether it's specifically in supply chain or other components of analytical pharmacy as well. So how does one get started in the field of procurement and supply chain? Well, first of all, if you want to do something simple, quick, and easy, there's a course that we've designed with UNDP that gives you an intro to procurement and supply chain. We recommend you to try it out. It won't make you experts, but it'll give you a good flavor for what it is. And it is, of course, free of cost. We've done it in English, French, Russian, and Spanish. Feel free to use any language, even though in Zimbabwe, very much like many of the other countries, it's all English. But if you are multilingual, then please do so. But how do you get the right accreditation so that you can work for the organizations at the right level? So the first thing I would recommend is a short course to see what are the options of careers in global health and supply chain. This is a short course of only 5 weeks, and it really guides you in terms of if you'd like to work either for a UN or for an international organization, what can you do to make a change? If you're in your, especially now, if you're in your 30s and 40s, plenty of time to, and the new approach to life really is about how we can, how we must continue to innovate, recreate ourselves as we move forward. Gone are the times where you do 1 degree, 1 diploma, and then you're done for life. It's every 10 years, you have to reinvent yourself, so add to your skill sets. And our children, every 5 years, will have to reinvent and learn something new in order to stay relevant. Our flagship course, which many of the people I've taken from around the world, more than 1,000 people are either taking it or have graduated, including many from the Ministry of Health of Zimbabwe, is the postgraduate diploma in global health, procurement and supply chain. It takes 1 year to do. And with this, many individuals have entered the UN system, Ministry of Health, international NGOs. This course is built for pharmacists who want to learn supply chain or supply chain folks who want to understand medicine. It's the only course that brings together the two components in a clear and comprehensive way, and it's been written by specialists in this field, for those who practice and the ones who've actually been currently working in this area and come from academia. These are a whole host of potential courses in different languages. And as you can see, we have different partners for these different courses. The first one is the postgraduate diploma. And we expect by the end of the year that those who've done the postgraduate diploma can spend 1 more year and reach a master's as well. And we will be launching a master's course in the coming, I would hope within the next 4 months, a master's should be launched as well. So you can take a certificate, grow it into a postgraduate diploma and grow that into a master's if you're not sure, or you can jump straight to a postgraduate diploma with different partner universities. And as you can see, these certificate courses are also accredited by the Pharmacy Council of Zimbabwe, by CIL to Tanzania, and various other partners as well. For more information, you can go to our website. It'll provide you more information, empowerschoolofhealth.org. And I'll ask my team to post it in the chat as well, so you have that too. and we've been working globally with all these organizations. And not only do you end up graduating, but we provide opportunities for you then to either work with us on our different projects. As we've shown you, we're working with donor agencies, ministries of health, WHO. Case in point is Florence, who's one of our graduates, is also our ambassador for Zimbabwe, and at the same time is able to support her colleagues as well. With that, I'd like us to move to the panel discussion where we ask a few questions to our panelists and get their perspectives as well to connect the dots. So if I could ask, who are we starting with? Let's start with the Ministry of Health and Mr. Davison. If you could please share your video if you're able to do so. And I will stop sharing my screen for the moment. And let me see if I can see Mr. Davison. And in the meantime, let me get my question ready for Mr. Davison, and then for the next panelist, I would have Prof. Andy ask the appropriate question. Mr. Davison, yes, I think I can see your video. Okay, perfect. Can you hear me? Can I continue? You are muted. If you could just unmute yourself for a second. Could I ask my team?
Yes, I can hear you. You can go ahead.
Perfect. Very good. Mr. Davison, so as a representative of Ministry of Health, as you mentioned earlier, more than 40% of the MOH budget, or around 40%, is usually spent on procurement and supply chain of health commodities, either products or services. And pharmacists play a key part in this, as you know. And we also know that pharmacists and logisticians have not been trained in procurement and supply chain in university, as was highlighted earlier by Prof. Andy. And my first question to you is, how have you, as a leader in the Department of Pharmaceutical Services at MOH, developed your own professional knowledge in procurement and supply chain?
Okay, thank you very much for that question. I started my career in hospital, straight from university. I started in hospital. And the time that I started, the pharmacy department was actually responsible for procurement of medicines and consumables. So mine was, I actually joined that, and I took part in it. It was really more of on-the-job training. The pharmacy did do the procurement, but without formal training. So there were procedures that we followed. We did the procurement, but later on, I think then government realized that this needed to be professionalized, and that's when government made a decision to actually separate, have a separate procurement team. And now the situation now in government is that for institutions, individual institutions that are allowed to procure, they actually have a procurement management unit, which is headed by a deputy director level for the high level institutions, with officers who have minimum procurement qualifications. The ministry did invest in short courses which I undertook in medicine management, as well as logistics and supply, where you were taught basic principles of forecasting, needs identification, quantification, all the different ways how you quantify and so on. And then at the hospital that I worked for, which is the biggest hospital in the country, Pharmaceutical Group of Hospitals, the management themselves made an initiative to train, to arrange for trainings. They would call, at that time, it was the State Procurement Board who would come and we would go like for a four-day training where we would be taken through the regulations and procedures. The procurement department itself did organize in-house trainings for staff. So that's basically how I learned, and from also reading myself, I've taken part in the national pharmaceutical company would also invite us to help in the evaluation of the various tenders. So from those interactions as well, because our national pharmaceutical company actually has a whole procurement department with people who have the qualifications. And these were pharmacists and pharmacy technicians who actually had some procurement qualifications. So from all those interactions, I was able to actually gain that. But I've also enrolled on the course, which I'm still to complete, the postgraduate diploma. But basically, that's what I would say. That's how I gained skills.
Thank you for that. That's very helpful. One more question for you. Many Ministry of Health, Procurement and Supply Chain staff are graduates of Empower School of Health in postgraduate diploma in supply chain. And as shared with the participants, the Secretary of Health has indicated the benefit this course has had. And how can Empower make this course more available to Ministry of Health staff, in your opinion? Mr. Davison, that I think you're on mute. This question was for you.
Yes, I was trying to unmute myself and failing. Thank you again for that question. We're grateful to UNDP who have supported a lot of the members in the Ministry of Health to undertake this particular course. So the issue will, one main issue will come back to the issue of the funding for that the people would require to undertake the course. And I guess they maybe need to, if maybe support can be gotten for more scholarships, maybe so that you can actually reach out to more people. I'm not sure how much of in terms of at any given time how many people can be supported from the scholarship that are currently available, but maybe to be looking at how maybe you can get other partners on board to actually also support the training, and
Right.
also really also just ensuring that there's awareness, because I'm sure there's still a lot of people who may not be aware that there's such a program, and I think in the ministry we need to make sure that we actually can make people aware of this course, and those that are interested can be able to take part in it. That's what I would say.
Right. I think that's a good suggestion, both awareness and increased potential sources of funding. So the funding from UNDP actually originally came from the Global Fund, with UNDP acting as the principal recipient. Now in many countries, Global Fund, World Bank, and USAID through GHSC PSM have funded many students, both in the ministry and civil society, if they are supporting the ministry. So I believe you're absolutely right that there are plenty of opportunities for getting more funding to support both the Ministry of Health staff and other organizations, whether it's faith-based organizations and otherwise, who are supporting the ministry in implementation. So that's something that we can explore jointly, and also explore directly with the donor at HQ level as well. I think that's very helpful. One last question for you before I turn it over to Prof. Andy is that the way to increase the number of pharmacists. I think it's consistent with what we just talked about as well. I should also mention that Empower, in addition to exploring joint funding from donors, also provides scholarship, which in many cases as high as up to 50%, depending on the funding that we can get from different sources. So that's the other way that we support the various students and participants. And after they graduate, where possible, we also try to employ them, give them consultancies so that they can, in fact, in most cases, the cost of the course is often made up very quickly, either by increase in salary, new job prospects, or even consultancy. So it's been a good investment from that point. Mr. Davison, thank you very much for your thoughts. Could I ask now Prof. Andy to take over from here?
Okay, greetings. And my questions are for Potifa, please, if you can unmute. Let me see if I can. Ah, yes. Okay, good. Okay. So about 50% of our participants are from the retail sector. I wondered if you could just take a moment and say something about your experiences in the retail sector of supply chain activities.
Okay. I think as indicated, you know, supply chain is quite a critical element for management of health, and actually considering that we in Zimbabwe are actually resource limited, elements of knowing the pharmaceutical supply chain are quite important in that one can then be able to manage the little resources that they have to make sure that they get the best health outcomes from the little that is available.
Okay, and thank you for that. And the other one is, if there are any plans in the country to introduce greater elements of supply chain training into the general pharmaceutical curricula at the academic institutions.
Okay, so I think what has happened before is that the two institutions, the University of Zimbabwe and the Harare Institute of Technology, which are basically training pharmacists in Zimbabwe, are training their undergraduates some elements of procurement and supply chain management. I think it's the course is offered, but only as they're just grazing the surface currently. They're not going as deep as one would want to. I mean, would want them to go in terms of actually people then making a decision to actually come into procurement and supply chain as a career opportunity. It's just maybe to get the pharmacy students, graduates, aware of the activities that they may be involved in.
Okay, that's very useful. Thank you. I'll hand back now to Prof. Paul to take on from there.
Thank you, Andy. One more question for the president of PSZ. How can PSZ do more jointly do more courses jointly with Empower, which can provide these global experiences? How do we work with your community, your members, to support them? What are some ideas in your mind that would help?
Okay, so basically the society has been since 2008 been involved in the continuous professional development of its members through offering these continuing education seminars and opportunities for pharmacists to actually explore their expertise, I mean, their interests. So with with an organization like Empower, we are able to actually get into a partnership where CEs and CPD activities can be provided during the forums that the Pharmaceutical Society can provide, so that the members can actually get as much as they can get. I mean, they can from the Empower School, but also the society members can actually come up and provide the areas that they feel they need to get some more training in, and maybe make proposals to Empower Health in terms, I mean, Empower School in terms of what courses they can offer and how they can structure them so that they can get as much members to be proficient in procurement and supply chain.
Right, right. Okay, that's very good. Let me also ask one question. Thank you very much for that, by the way. If I could just ask one question to Florence. Florence, you're a graduate of Empower and you're representing Empower in Zimbabwe. What are some ways that you are exploring making procurement and supply chain education more available and more relevant for pharmacists who are interested in supply chain?
Thank you, Prof, for that question. First of all, I would like to mention that we currently have 87 pharmacists who've enrolled in the postgraduate diploma, and 40 of them have graduated, and most of them have been with the Ministry of Health, and 47 are actually pursuing, and hopefully before the end of the year they'll be graduating as well. So that will add on to the number of graduates that have come through Empower. So realizing that the Ministry of Health requires a lot of pharmacists to take care of their pharmaceutical services, we're actually working with the ministry to try and ensure that we look for funding and try and sponsor at least 20 students per year. And we've realized that some of our pharmacists, pharmacy technicians, and health professions cannot afford to enroll on their own in the Empower School of Health. So we are working together with many donor communities, with the likes of UNDP, the Global Fund. They're also willing to support us in scholarships for the Ministry of Health. We've also realized that the private sector is not been participating in the supply chain management on a global level as well. So we are also trying to raise awareness, and this is one of the examples of awareness that we're trying to ensure that everyone is enticed to join the global health and supply chain management field. We are also working with the teaching institutions, with the likes of the university, HIPH, and hopefully we are going to be concluding partnerships so that we can introduce the postgraduate diploma in these institutions. And we are also working with them so that they can also be able to provide the short courses in the event that somebody does not want to do the full postgraduate diploma. They will be able to take certain courses within the supply chain management field. And we also wanting to raise awareness so that people who are interested as well can go directly through our website as Empower. They can enroll. They can start off with the free courses that are being supplied by UNDP. And once they feel that this is what is in for them, then they can go for the short courses. From the short courses, then they move on to the postgraduate diploma, and hopefully also move on to the master's program that is going to be introduced shortly. So yes, we would like to make sure that everybody joins the bandwagon and enjoys the benefits of being a supply chain specialist. Thank you.
Florence, thank you very much. All the panelists, thank you very much for this. It's extremely helpful. I've seen several. I'm going to open up the discussion for the various participants. Thank you all for attending. If you can please type your questions. I see some of you have already typed your question, and we'll start to, I request the various panelists and faculty members to read some of those questions and please reply. And before we do that, one main overarching point to everybody. For us, I understand, I've lived in very difficult, very challenging environments and countries myself. Besides India, I've spent time in Afghanistan, in Papua New Guinea. I've lived in Lagos, Nigeria, when things were not that great. And I've been to Harare myself a few times, and I know how difficult things are there right now. And especially with inflation and hard currency, etc. So whatever we can do to help support learners, and I know Zimbabweans have a thirst for learning, and even today they will find a way to invest in education even if they can't eat. That's the stereotype of how much they believe in education. Zimbabweans believe in education. That said, the pricing of our courses is usually half to quarter what global institutions are charging. So they are relatively inexpensive. But like we mentioned earlier, if you can't afford it, we look for ways of getting funding from donors, or even doing the free courses that we've designed for other partners such as UNDP and Global Fund and others. The courses range anywhere from $200 for the certificate course up to $2,500 for the postgraduate diploma. The master's, when it will be introduced, will be around, I suppose, $5,000, but it is not out yet. So there's a whole range from zero all the way up to $2,500 today. And what I would do at this stage is look at what are some of those questions. One question that came up is the SIP certification useful, and is it recognized? So SIPs and CILT are both excellent certificate courses that you can take. They're very well respected in the sector. In fact, we partner with CILT, as I've shared with you, and what pharmacists often struggle with and others struggle with is the fact that it is SIPs and CILT is meant for supply chain in any sector, anywhere. So the learning that you will do is actually they are developing and preparing people in procurement and supply chain to work in, whether it's electronics or automotive or the food sector or agriculture. And often that is not what we are looking for. We are specialists in the health sector, and we're looking to apply our capability there. So in fact, CILT teamed up with us because of the feedback that they've received from their learners to see how we work with them, and we bring the health and pharmaceutical expertise within the supply chain. So if you've done it, you'll find our course useful. If you haven't done it, you may wish to explore from that point of view as well. Let me pause, ask people to send more questions, but Prof. Andy, is there a question that you would like to respond? And then
okay, we have a few there. We've got Stephen Becky asking, how long is it to do a fast track course? That would be the postgraduate diploma, a minimum of 11 months. However, that is very hard work. People who have done the course will tell you it's an intensive course. It requires a lot of input. And can you get hired while you're doing the course? Yes, it's happened to some of our students, but I would have to say it's not very likely. You really need to complete the course in order to get a hire. But it does happen. Some of our participants in the course do get hired before they have completed the course. Okay. I've got a query from the USA here that medicine management appears to mean something different in the USA. Yes, it does. That's really around the clinical aspects of managing individual medicine regimes for patients. In global health, it refers generally to procurement and supply chain management, but the terminology is changing. We no longer use the term medicines management. We are specific for PSM, procurement, supply chain management. So we try to keep away from that clinical aspect of individual patient management. Okay.
Let me ask, yeah, Davison, please go ahead.
Okay, thank you. I'm seeing a question which says, are there posts available in the Ministry of Health for supply chain management graduates? In terms of the structure at ministry level, I would say currently the posts that require people with supply chain expertise are actually seconded posts and supported by various partners. This was actually a strategy that was formulated and presented to partners after recognizing that the structure at ministry didn't have those posts that were needed for the critical function of medicine, of supply chain management in medicines. So currently, mostly they are like seconded and supported, but the vision in the long run is to actually have the government itself create those posts so that they are actually government posts. So I think in summary, that's what I would say. So what's available is those posts, but they are seconded and supported by various partners. Over.
Right.
Okay, if I take one and then you take the latest CIP one again. Do we need a master's in public health to have a fulfilling career in public health PSM? The simple answer is no. A master's in public health is always beneficial. It's not a requirement to be able to enter the field of PSM.
Thank you.
Paul, we've got one there. Is CIP and Empower the same provider?
No, we are distinct organizations, and we have partnered with, so there's CIPS, Chartered Institute for Procurement Supply, there's CILT, Chartered Institute for Logistics and Transportation, and these are UK-based entities, and they're the ones who are most common in Commonwealth countries such as, well, obviously Zimbabwe, India, and across Anglophone Africa. We have partnerships with various entities, with CILT, with pharmaceutical societies. We don't have one with SIPs. We are in discussions with them as well. Okay, but they're two different entities.
I will say our courses are substantially different from the CIPS and the CILT courses. It really is very different.
And that's where what I've mentioned earlier, it's bringing, we bring it from perspective of health and supply chain point of view. If you want to work in global health, this is the type of course, and if you're a pharmacist, this is about the only option that you have. If you want to work in supply chain across anywhere, then SIPS and CILT is a better option for you if you want to work, if you think you might work outside the health sector as well. Evelyn from Kenya has asked, how can we access funding or sponsorship for the course? Really, if you're looking for funding or sponsorship, ideally goes back to Davidson's point as well and the experience he shared. If you're working for a ministry, then, and many countries are in fact, as they're submitting proposals and funding requests to Global Fund and other donors, have included a small country like Liberia. Liberia and Sierra Leone have included almost 200 people to be trained in procurement and supply chain with Empower. So a country like Zimbabwe could easily put in, I don't know, 50, 100 people to be trained over the next few years, next couple of years, and request for that type of funding. So Evelyn, if you maybe through your it's very difficult to get one-off funding. Your organization could apply for funding depending on how they are linked with the ministry, or your option would be a scholarship is the other one. Anything else? Keep adding your questions, please. We do know that only half of you were, we'll do this for a couple more minutes. Also because the place where I and Andy are, it's almost 11 o'clock at night. No, midnight, I'm sorry. So we'll do this for a couple more minutes and then we would have a short poll again that will help guide us as well. Mr. Davison, Mr. Portifa, is there anything else that you see, or would you like to share any comments anyway? No, I don't. Sorry,
yes,
you might need to unmute
yes,
them. Yes,
Paul.
please go ahead.
Yes, thank you. I think it's. I would say this has been useful for me because I've been, getting arguments from certain people who say for you to be in supply chain of medicines, you don't need to be a pharmacist. So this is I've been hearing this, that in terms of other people, they would say you don't need to be a pharmacist to have that. But I think this actually demonstrates that no, this is a specialist area, and this course is actually has that approach and perspective of a specialist, and it actually gives you more skills than a person who has just done, for example, like the other general courses that you were talking about. So I think I appreciate this course, and I think it's very useful. Thank you.
Yes, no, thank you for that. There's been this continuous debate, and especially with donors and happening a bit more these days, is why should pharmacists do procurement and supply chain? Why can't a procurement specialist just move medicines? And if they can move other products, they should be able to move this as well. And my response is, well, when we talk about, let's understand the entire continuum of procurement and supply chain, and then you get the full picture. Because for you to make an educated, informed decision, you better be able to speak about product selection, product specification, quality assurance, and of the multiple steps that are involved, there are several of them that require knowledge about the products as well. There are some steps that may not take MIS, Management Information Systems, or IT, that may not be required, but there are many other steps that require you to be a pharmacist. So within this very broad area of procurement and supply chain, you need lawyers, you need finance experts, you need pharmacists, you need supply chain experts. So, and if we're talking about lab supply chain, you want to bring in maybe biomedical engineers. So it's really how you structure and position it, but the role of a pharmacist is central to moving these 30–40% of the Ministry of Health budget indeed. Okay. Very good.
Yeah.
So with that, Mr. Portifa, anything from your side? Last closing remarks.
Okay. Maybe from me is to say that also from procurement and supply chain is also important, even for the guys in private sector. I think over the last couple of years, we have seen a couple of disasters where even if you are in private practice, your skills in procurement and supply are requested. We need to look beyond just government and the multi-donor agencies. We also need to look at civic society, where we have in Zimbabwe a number of small groupings of people coming together, trying to help maybe 2 or 3 people, and usually they call upon a pharmacist to actually assist. So knowing the elements of procurement and supply chain would help. And in this regard, I would look at maybe asking Empower to come up with short courses, which the guys in private sector can maybe enroll and maybe take up, so that they can appreciate some of the critical elements that are needed. Because unfortunately, the pharmacist is actually an all-rounder, whether they're in private or public sector, and the nation usually comes to call onto them for the expertise that they have. Thank you.
Right. In fact, somebody had suggested earlier that since many people are still working in retail pharmacy and running their own retail pharmacy, short courses on managing and growing retail pharmacy outlets, what would be a course on that? I don't know if that is of interest or not. So if that's your area of interest and you're looking for courses in that area, you can please type it in or email it to us as well and let us know what is needed. Okay, so happy to do that. Prof. Andy, any last words?
Okay, it's an exciting field, it's a challenging field, it applies very much in the private sector as well. If we take a simple example, many of you will be working in retail pharmacy from the poll. How many of you understand economic order quantity and economic order levels? These are well established but little used in low-income countries. They should be there now. We have the technology to introduce them now into the private sector supply chain. They should be there. How many of you have used mean kinetic temperature measurements since you left university? And yet you're controlling your stock. All of that is part of private sector and retail pharmacy supply chain, often not implemented. We have to get it implemented. We have to move forward. So there's lots around supply chain for the private sector as well. Many thanks for being with us. Many thanks for the course. There's one poll to come yet. Please don't leave until you've completed the poll.
In fact, could we take it to the next poll, please? All right, let's see how quickly it works here.
Poll is on your screen now. Please vote. Oh, much slower on this poll. Okay. One minute and only 10% voted. Okay, we're going faster now. We're coming up to 70%. That's good. Let's take it up to the 2-minute mark. Okay, let's stop the polling, please, and share the results. Okay, so a lot of interest in global health supply chain, 85%. Most people heard of us through PSZ. Okay. Okay, and social media seems to be the way to go forward for everyone to contact each other. And most people are members of the Pharmacy Council. Very low FIP membership. I think we'll have to do some marketing there to put the merits of FIP membership out there. And have you taken a course with Empower before? Okay, quite a lot of interest, but not many people yet have undertaken the courses. And most people found the webinar useful. Okay, so thank you very much for being with us. We can stop sharing the results now, please. And Prof. Paul, for the final word.
Yes, I'd like to thank everybody. First of all, participants first, then the panelists, and then the organizers, especially the team that's been busy coordinating, managing the entire webinar, promoting it, etc. They've been tirelessly working on this back to back. So thank you for everyone who's been doing this. May I, for the closing remarks, hand it back to the moderators to bring closure. And from my side, thank you very much.
All right. Thank you. Thank you. I hope everyone enjoyed the session. As I can tell from the polls, I think we did learn quite a lot. So last but not least, I am now going to share the link to where you're going to get your certificate. Just to be clear, this link is going to expire in an hour. So I will be here to help anyone who's facing any challenges. However, after an hour, I cannot assist anyone because the link automatically expires on its own. So I'm going to share the link on the chat box. I don't know if you guys can see it. Yes, and so you can just try the link and then it should send you a certificate automatically. And thank you, everyone. Thank you to the panelists. Thank you to the organizers, Pharmaceutical Society of Zimbabwe. Thank you to Empower and all the partner organizations that we've been partnering with. I'm sure it was an informative session across all experience, number of years of experience. And I think we've come to the end of it. If anyone is facing any challenges with the certification, you can let me know in the chat box. So at this point, if you get your certificate, you're free to leave. If you're having any challenges, I'll stick around for maybe 15 more minutes to help anyone and everyone. And remember, the link will expire in an hour and I can't do anything about it. Thank you so much. Have a great night. Have a good morning. Have a great evening. I know we are from all over the world, but safe to say, enjoy. Thank you, guys. I don't know if Mrs. Chungana, you have any parting remarks?
Lawrence, over to you for, of course, and then you bring closure to this as well. Thank you.
Thank you so much, Prosper, for being such a good moderator. Thank you so much, all the panelists, Prof. Paul, Prof. Andy, And thank you so much as well to our president, Mr. Mwendera, as well as our director, Mr. Vuragu. You did very well, and you articulated all the issues very well. And we are thanking all the participants who joined us, and we are hoping that we were able, as Empower, to entice you into developing a career in supply chain management. And please feel free to contact me for any questions that you would want. If you really want to join and further your education in postgraduate diploma with the Empower Group of specifically Empower School of Health. My number is I'm not sure whether it's on the flyer, but it's 0772 235 646. Feel free to call me and I'll be able to help with any questions that you have. Thank you so much. Have a good evening and have a good morning. Thank you.
Lawrence, you can type your number in the chat for everyone as well in case they missed it.
Thank you, Prof.
All right, that's great. And I'm so excited to receive my first Pharmaceutical Society certificate that I have registered for it as well. And I hope to get it. I will frame it. I got my certificate printed already. Someone has already printed theirs. I love this system. We need to create something like this ourselves. Let me see if I have received my first PSZ. I think I have. There is. This is very exciting indeed. Oh, look at that. It's to certify that I haven't attended my own webinar along with PSZ. This is great. Excellent, excellent. So very efficient system, I have to admit. And I have not seen it. We've done many webinars with many partner organizations. And this is extremely efficient. So congratulations. We need to adopt something similar. Rahul and team, please note. All right. Okay. So thank you, everybody. Thank you, moderators. Thank you, everybody else. Have a great day. Take care. All the best.